The need for dentistry in the UK has never been so much than now.
Whether I should give the ORE or the LDS exam while going to the UK.
So both will give you access to doing dentistry in the UK. If you're looking after prestigious titles, go for the LDS. If you want this normal route, then go with the ORE.
What are the common mistakes do people from India usually make when they're making this shoot or giving this exam?
Most important mistakes they make is not starting early enough. Now, if you're waiting to get a seat and then you start the educational pathways, that's a problem.
Why can't I crack the ORE exam on my own?
Clinicians and international graduate dentists underestimate how much legislation there is. I mean, UK has got the highest rate of law culture and suing culture.
Is there actually job opportunities in the UK for the dentist?
Coming to the UK, if you're just coming for the money side, don't come. Indian dentists, they don't need the UK. UK needs dentists.
Hi, I'm Dr. Satish Kumar from Kaizen Dental. A lot of you all ask me that I am planning to go abroad, but I want the right mentorship. Similarly, when it comes to UK, if you're trying to go there, you want the right mentors to guide you. Today, I have with us Dr. Kish and Dr. Jay, who have come all the way from UK. They are coming on behalf of the Smile Dental Academy. Smile Dental Academy has tied up with IDA to come up with a structured program to help you clear the ORE and LDS exams and settle in the UK. So, I welcome them on board.
Thank you so much. Thank you for having us.
Thank you for having us. It's an honor.
So my first question to you is, for someone who is confused that whether I should give the ORE or the LDS exam while going to the UK, what is your answer to that person?
So it's a good question which a lot of people have been asking us and messaging us, especially with the new collaboration we have with the IDA. So the first thing you need to decide is the reason you want to come to the UK as well. We've got two pathways to enter the UK: to register with the General Dental Council. That's via the ORE exam, which is an exam owned by the General Dental Council, and you've got the LDS exam, which is from the Royal College of Surgeons, England.
So when choosing which pathway to go for, we always think, what is the reason why you're doing it, number one, and what is it going to give you? So both will give you access to doing dentistry in the UK. The difference is the ORE, as Dr. Jin said, is GDC run, whereas the LDS will give you an extra title. So it'll give you an extra diploma, and it's a little bit more prestigious. So if you're looking after prestigious titles, go for the LDS. If you want this normal route, then go with the ORE.
Now, currently the ORE capacity has increased, and in 2026, the number of seats are increasing. We've heard there are talks for the LDS numbers to increase as well, but it's not official yet. And I think in January there'll be some big announcement from the Royal College of Surgeons, England. But whichever route we're thinking of, the need for dentistry in the UK has never been so much than now. So both the routes are available. Predominantly we're focusing on ORE training currently, but we've been told in January 2026 there'll be some big news with LDS training. Both examinations content-wise are similar. ORE is a 2-part examination, LDS is a 3-part examination. But again, it will assess you to make sure you are safe and fit to practice as a dentist in the UK.
Understood. So basically, the Global Dental Connect program, which Smile Academy runs, would train the students to give both ORE and LDS exams, correct?
Correct. So we launched this program this summer, and 1st of September was our first batch. We've been focusing on ORE training now. We're going to be covering LDS and ORE training. We're quite fortunate with Smile Academy and Smile Clinic Group in the UK. We work very closely with the Chief Dental Officer and the Royal College of Surgeons, and they will be increasing capacity for the LDS exam. Based on that and the need for that, we are going to be involving that training for our global dentist program as well.
Correct. One thing that we're very good at doing is adapting very quickly to the needs. And with the UK government, things are constantly changing. Constantly changing. So we can adapt very quickly, and especially with the news for the LDS side of things, we've got a whole new pathway coming out in terms of the education side, just for the LDS side as well.
Understood. So one advantage for the students who are going to the exam is they are teaching both LDS and ORE. So whichever route opens or you want to take, the advantage is it is in one course. Previously, if you were thinking and you were confused that I want to study, but then later I will decide which exam to take, You did not have that option at that point of time. My question to you is, you have seen a lot of students come and give these ORE and LDS exams. What are the common mistakes do people from India usually make when they're in this shit or giving this exam?
I think one of the most important mistakes they make is not starting early enough. They are looking to sort the job out first, or looking for a position, or thinking about the visa, but they don't start early enough. And the process takes a little bit of time. So a lot of them have come to India and are working as waiters or waitresses, but haven't actually started the ORE pathway because they're waiting to get a seat. Now, if you're waiting to get a seat and then you start the educational pathway, that's a problem, because you may not be educated enough to pass that exam. It's a very difficult exam. So we always say the most common mistake is they don't start early. So our advice is start early.
Understood. So basically what the problem happens is they are not ready for the exam. So they are waiting to get a date and then they start studying. And when they're giving the exam, they are rushed. And then they might fail thinking that the exam is tough rather than they actually prepared less. That absolutely makes sense, and I've seen that quite often as well. Okay. My next question to you, you told me that this process takes time, the ORE part 1 and part 2. Imagine I just cleared my BDS today and I've decided to enroll with you guys because I love your vibe and everything. What is the rough time frame I'm looking for to give my ORE part 1 and part 2 exams, and by say how many weeks or years I would be there in the UK?
So with the idea, we provide a very clear timeline of start to finish, how long it will take. We say about 60 weeks from start to finish, but this is based on you getting a place on the actual examination. Now, we all know getting a place is quite tricky at the moment. The UK government, the GDC are working on increasing capacity, and with the LDS capacity increasing, if that is successful, we're saying about 60 weeks you should from start to finish have relocated to the UK. We're saying on average with the backlog it's taken about 2 years with previous delegates. But with anyone new joining with the new uptake, we're saying about 60 weeks as well.
Understood. So optimistically, you should think around 60 weeks. But worst case situation, you should have 2 to 2.5 years.
Correct.
So you shouldn't always play on the over optimistic thing. So around 2.5 years, 2.5, maximum 3 years is something you should be willing to work with, right?
Which is the amount of time frame based on the new legislation, which exam comes up, which will get you prepared for. And the main thing is preparing for it. I mean, a lot of the question about where the main failures have occurred is people not preparing correctly and not having the right guidance as well. So we've seen a lot of delegates preparing for the ORE, LDS, based on how their degree was in India. Now this is based on UK BDS degree, based on UK legislation. UK has got very clear guidelines. So we've got very clear guidelines from all our different faculties, from Royal College of Surgeons, from the BSP, BES, all the different societies have their guidelines. So we need to know these guidelines inside out, and it's very black and white. So where the failures occur is not knowing the UK law, legislation, guidelines, and that's when failure can happen. So having the right mentor to support you, who knows this, is key.
Understood. So basically, dentists tend to underestimate the exam pattern, is what you're trying to...
Absolutely, absolutely. I mean, this is an exam. It's examining on specific things, specific measurements, specific outcomes. And if you've learned the right outcomes and you're a safe practitioner, you should have no issue passing it first time. But it's about knowing what is needed from the UK registration side.
Understood. So you were talking about the importance of mentorship. Could you just tell me how is the course structured, and what is the advantage of having a structured course rather than, see, I think my BDS degree has taught me enough that I can give a exam. I've cracked the NEET MDS or the NEET exam. So why can't I crack the ORE exam on my own? Why do you feel I need help for that?
Absolutely, that's a great question. We get a lot of people asking and previously have attempted it on their own. This is a very specific exam, examining on very specific things. So we need tutors and mentors who've been through the process or have been past examiners themselves. So our whole team is either been on the ORE side and done the training themselves, or are past examiners. We also need to make sure we understand what's required in the exam itself and the support as well.
We always say that mentorship is required at every stage of life. So this is one of those elements where you might have passed your BDS in India, you've done all your exams, But this is a very different type of exam. It's very specific with very specific needs. So where you have someone who can help walk alongside you, show you the pathway and exactly what elements you need to focus on, it will shorten the amount of time that you take to do that process, but also it will give you more confidence when you go into that exam, knowing that someone who's been through that process or has lectured on that process is there and has told you exactly what to expect and how to handle it in those situations.
And Dr. Kish, nicely said, it is a journey. And that mentorship is not just for ORE Part 1 or not just for ORE Part 2. We collaborate with the IDA because we do a lot of revision courses in the UK, meet a lot of dentists in the UK from India, Pakistan, sub-Asian continent. And some of the stories we hear is worrying, and they're not supported enough, not just for ORE Part 1 or Part 2, but once they have passed it, being relocated in a new community, a new environment, working in the NHS, new support system. In the UK, I think a lot of clinicians and international graduate dentists underestimate how much legislation there is. UK has got the highest rate of law culture and suing culture, and litigation is the highest. So your record keeping, communication skills need to be really high. So the mentoring is for ORE Part 1, Part 2, but also as you continue the process, you're getting allocated into a practice, we will support you throughout the process.
One of the other things that most people probably don't realize about the exam is that it focuses on softer skills. So a lot of it's practical, but also OSCE stations. So that's where they're testing your communication skills, how you build rapport, what's your note-taking like. Now this is all stuff at university, we don't focus on that. We focus on academics. Whereas when it comes to the OSCE part, being able to speak clearly, slowly, and understand, and then relay that information back in a structured format, which is what the examiners are looking for, that's what our mentors help with.
Understood. This reminds me something that I was always told. We always end up thinking that I need mentorship at the start of my career. The problem is you actually need more mentorship as you go up your career. Because at the start it is easy, you can learn on your own. But as you grow, as you go up the steps, it is something you have not seen before. Your friends and family won't be able to guide you because they have not gone through it. So having mentors in such situations is always handy. That's the first thing I would like to come to. Second, for the audience who might have not understood what he meant by OSCE. OSCE are basically, remember your BDS exams, you had spotters and you had to go from table to table. Similarly, in OSCE there are like 20 tables. There are different situations which might happen in the clinical practice. Some might be suturing, some might be of different giving medications. Or in that, one is a role play where you have to communicate with the patient and explain the patient what his treatment and diagnosis is. There will be an actor on the other side of it. So this is something which we are not being taught in India, but since in UK they know you're going to treat patients from their country, they want you to be comfortable with it. So learning this communication skills is, yes, I don't think unless under your practice you can do this.
Now once someone has decided they want to give the ORE, okay, they have registered through it, they have cleared the exams, you have told me you're going to guide them through the entire ORE exam process. Once I clear the ORE exam process, what are the next steps of getting into a proper career in the UK?
That's a very good question. People almost think passing ORE Part 1, Part 2 is the harder part. I would say that's the most straightforward part. The next stage is actually the harder part. Finding the right practice for you with the right community where you fit in. And that's the demographics of the area, but also the practice and the practice itself and how it all works with your nursing team, reception staff, managers, making sure you're in the right ecosystem.
You've got dentists coming over from India to the UK. It's often they're not by themselves. They have a young family. They've got partners, they've got parents they want to bring across. So for us at Smile, what we've done is we've helped hundreds of Indian dentists relocate, but also get them into the right communities, to help them invest into that future, to be able to then blend into that community and work well within that community as well. For example, we've had young dentists come over with young families, with young children, and it's about finding the right schools for those children. So often we'll put them in touch with the local practice who've got very good links to the local schools, to the local communities, and they'll help advise where's the best place to live, where's the best schools for your children. So it's a holistic approach. it's not just focusing on the examination part, it's the after bit, which is the most important part. Where am I going to relocate to? Where am I going to settle in and build a future for my family, which will be there for a long time?
So you've passed ORE Part 2, you're going to register with the GDC, which the team will support you with, and you're going to decide whether you want to go down private dentistry route or work on the NHS. And these are two different pathways. Now, our recommendation for any clinician starting in the UK is to work with the NHS for a couple of reasons. A, you're supporting those very patients that need the care and helping with access. Secondly, the number of volume of patients you'll see as well, you'll get a variety of cases and build your skill set up. Which is all good knowing dentistry, but dentistry in the UK, treatment planning is very different as well. And then you'll decide whether it's NHS or private. If you're going down the NHS route, you'll need a performer number, which is your license to work on the NHS. And in the UK, it's called PLVE, Performer List Validation Equivalence. You'll go through that process where you'll be allocated a clinical advisor and a mentor in your practice to get your performer number as well. And there are a lot of perks of working on the NHS, such as a pension, maternity, paternity leave, and it's very well supported. And as things are progressing in the UK now as well, and with the work we're doing with the Chief Dental Officer, Jason Wong as well, they very much want to support the NHS clinicians who are supporting the communities as well.
Understood. So the guidance you'll give does not stop with exams. You're trying to support people make the entire shift start to finish. So you're helping them from the start of the registration process through giving the exams, and once they clear the exams, you're going to help them understand which community would suit them and where they can settle. That's amazing what you guys are doing. But my next question to you is, they're always this saying that the grass looks greener on the other side. Is there actually job opportunities in the UK for the dentist? Number one. If yes, are there specific areas I need to go to? Are all of them in the outskirts? If I go to those places, will I get a good standard of life?
Yeah, there is definitely a lot of jobs available already in the UK. I think the total was about 11,000.
So recent statistics have shown there's about 2,700 NHS jobs live and over 1,000 jobs on the private sector. But I think the stats we've seen is close to 8,000 jobs fully available in the UK. So there are a lot of jobs available. My suggestion and our suggestion is always, if you want to work in the centre of London, right next to Harley Street, Wimbledon Street, my advice is don't bother. Again, the GDC, the General Dental Council, did a survey, and the closer you are to central London, did a little pin mark, the higher risk of getting sued as well. So my suggestion is just for dentistry, but also for family life, the further out you are, you will enjoy it better. So there's a lot of job opportunities all over the UK, very predominantly areas such as Suffolk, Norfolk. You've got a lot of areas in Wales and Scotland where there's a big need for dentists as well. And these areas are very nice areas for building your families as well. And a lot of the international graduated dentists will be looking for communities where there are similar cultures as well. And all these areas have got big Indian communities as well.
There's a common misconception that when people move, they want to move to London because London is where you're going to earn the most. That's not true. Places like Norfolk, Suffolk, a lot of people move from London to retire to these places because they're sick of the London lifestyle. So they have a lot of disposable income. So those areas where there are a lack of dentists is actually where there's most available growth from a dental perspective and also from an income perspective.
As we were discussing earlier, coming to the UK, if you're just coming for the money side, don't come. There's a lot of other factors you need to think about. And you need to think about your family, long-term perspectives, culture. All of these things you need to consider when you're deciding this move and making sure your family are supporting on this move as well. So today we had a session with a lot of clinicians, and there are a lot of young clinicians graduating recently want to move. But you also have some older clinicians with young families, and it's a big decision to make. So our teams have been through the process. We compare them up, you can get some feedback, get feedback on different areas, and make sure it really is the move for you.
Dr. Jit, I really love that answer. The reason is, what I see is when people come to sell, they tell you what I'm selling is the best. You're being honest, saying that if you're coming to the UK, think about other factors and then make the call. So for anyone in the audience, yes, they can guide you through the UK process. But whether you have to go to UK or not,
has to be a personal decision. Once you decide to go through it, they will always back you up. But make the choice. Once you make your choice, you know who the right people are because they are not going to misguide you. You were talking about families moving to the UK or a young person. I want you to tell me both scenarios. Now, I have finished my ORE, I have shifted to the UK, okay? How the first 6-12 month period would look, how would my salary graph look, and how would be the career graph look?
So we always say that within the first year, it's always a base of about £40,000. That's a base, that's the minimum amount that you would earn. Most dentists who come to the UK will be starting on about 50 to 60. But we always say a base minimum of 40,000. That year is going to be you getting used to clinical practice, working on the NHS, doing a little bit of private dentistry, but more so getting to know the team, the community, finding your feet within that practice. Year 2, we then expect the income to go up to about 65 to 70,000 pounds. And we always say that shift happens if you invest in some education, be that diploma in restorative dentistry, which improves your foundation level learning, but allows you to do more complex treatments. Then after that, year 3, we've got dentists who are on over £100,000 a year. And that's all because they've invested in the right time in their education, got the right practice with the right mentors, the right support network around them, so that they can do their dentistry that they want to do, not doing more dentistry, but less dentistry in less hours. So that way they're actually earning way more.
And the beauty with a lot of dentistry in the UK, they're very clear pathways. So we've had dentists who graduated from India, come to the UK, passed ORE Part 1, Part 2, bought one practice or 2 practices, bought a group of practices, now gone down the business route. We've had other clinicians who've gone down the academic path, lecturing, research. So there are a lot of very clear pathways. Even if you hold postgrad degrees from abroad and you want to come to the UK, you can utilize it. There's specific pathways you can follow. But so it's very a pathway-orientated country and a process-driven, and that way it can support you whichever part of dentistry you want to end up in.
Understood. I would like to take you back to a question you told about getting either into the private route or into the NHS. Okay, what are the difference between the NHS practice and a private practice? And if I have just shifted into the UK, you told me that NHS is a good place to start. What is the difference in the private and the NHS practice?
So that's a good question. A lot of people ask difference between NHS and private. So the UK government has got a budget for all medical and dental support, and it's got a big budget. From that, part of it's allocated to dentistry. It's got a capped budget of money, dentistry, and then they put that money into different areas. So, for example, London will get a certain budget, Suffolk will, Norfolk will. Then they have that allocated per practice. So each practice will have an allocated budget of NHS work, which is government funded work. The government will subsidise the work, and in the UK, any NHS work you do is called Units of Dental Activity, UDAs. That is the currency which we use to convert to pounds. That is subsidised by the government. Those who cannot afford for healthcare, the government will cover it for free of charge, and there's a whole list of patients. For the rest of the population who have got access to it, it will reduce it. So there's band 1, band 2 and band 3 charges for NHS work. So with NHS, what you get is a lot of patients coming through the door. There's no need for any marketing. There was a situation where a new practice opened up in Bristol. They had a 2-mile queue down the road. It was on the front page papers and on BBC News because of access. So with NHS dentistry, you'll get access. Again, from that, you can still do private dentistry as well. So in the UK, NHS and private dentistry work side by side. If one was to go, the other would suffer. Both are supporting each other in the UK. Private dentistry is funded fully by the patient. So if a filling is needed or a crown or an implant, it's fully funded by the patient. There's no subsidized costs by the government at all. So again, certain demographic of patients will go for it. Certain areas that will be more affluent areas will be better as well. But what we find in the UK, where a lot of our practice, Suffolk, Norfolk, patients are opting for some private services to support as well.
We often find that the reason why we say go into an NHS practice is because, as Dr. Jin said, we always say give options to your patients. So you have your NHS options, but the government also says, the GDC also says, you have to give private options as well. So then it's up to the patient to decide what treatment they decide to go for. So the reason why we say start off on NHS is because you have a constant flow of patients coming to see you. Yes, they have certain demands, but so do private patients. And going fully into private practice, straight off doing ORE is often a challenge because it takes time to get used to the UK culture of dentistry, where you can learn that culture very, very quickly on the NHS because the amount of patients that you see. But again, don't forget there is always the option to give private options and do private dentistry within your NHS practices.
You made me feel very optimistic about shifting to UK when you told me that there was a 2-mile line out there. So basically there is no dearth of patients, okay? Second thing, you told me that it is better in the rural areas or the outskirts. I think that's the same situation in India, okay? We always think about tier 1 cities, but tier 1 cities usually has competition and other problems as well. So tier 2 and tier 3 where the actual money is, similar to the UK. I got a rough idea about the entire process, the journey, how we're going to support them. Is there any advice? Imagine there's a young guy who just walked in, finished his BDS, coming to you and telling Dr. Jin or Dr. Kish, give me one advice of whether I should shift to the UK or not. 1. 2. If I'm planning to go through this process, what should I do? What would your advice be?
The first thing is someone considering of shifting. My advice firstly for any young new graduate is invest in yourself. So whether you're investing in India itself and investing in yourself and skilling up, or you want to come to the UK, invest in yourself. So if your idea is to come to UK, invest in a course or a program or someone to support you to find out how the process is. That's number 1. Also keep in mind, Indian dentists, they don't need the UK. UK needs dentists. I'm going to make it very clear, anyone in India, they don't need the UK, but UK does need dentists. Now, whether they come from India or whether they come from other parts of the world, we've got a shortage of dentists at the moment. There is a backlog in the ORE, but there's a huge shortage. So the need is very much now. So anyone who's young, graduating, they need to think ahead. Now, we discussed earlier other countries such as Australia, Canada, USA. But everywhere has got its challenges of its own, and there's all time, money, and energy as well.
One thing that I would suggest is don't do it alone. One thing we say in life is don't go on any journey alone. Find a good group of people around you to support you, be that mentorship side, but also peers as well. So when you go through this process, make sure there's a few of you going through the process together. It'll give you the strength you need in the difficult times, but also it'll give you the laughs you need in the good times. And that to me is very, very important.
I love that advice, Dr. Kish. It is basically that mentorship is one-on-one. But when you join a cohort, like how they have a cohort of 15 people is what they're taking currently, is you not just get the mentorship, you see how the rest of the 14 people are also going through the journey. And when it is done as a team, it is always uplifting and motivating. So finding the right team or the right group always makes a lot of difference. So thank you, Dr. Jin, and thank you, Dr. Kish, for taking out your time and joining us today.
So it's a pleasure, and it's the journey which we're on. A lot of you may not be aware, I met Dr. Kish on the first day of university at the age of 18. So King's College London, there's 220 in our year. We got split up into 12 tutor groups, sat down, and he's the first person I met in my batch.
Literally, I sat down here, I looked to my left, and there's Dr. Jin. And we say the rest is history. But again, going on that journey together has been incredible. But not only because it's fun, but also because you look back and you think the challenges we've had, how we've overcome them, how we've grown, but also you help push each other. And that's one of the most important things.
So we talk about mentoring, but you got co-mentoring as well. And by supporting each other, you're pushing each other, investing in yourself, but pushing the boundaries as well, which is what it's about.